First off, my name is Dr. Ashraf. I'm a practicing pulmonologist and intensivist at Wellstar in the Atlanta area. Kivo was introduced to me via Amanda, actually. She came and did a quick program introduction. For me, I really value pulmonary rehab, but the issue in my geographic location is we don't have a nearby area, and we serve a lot of COPD patients that are unable to get to our rehab program. So when she brought it up, I immediately was like, okay, this could be a very valuable resource, and that's what kind of led me to starting referring patients over to Kivo. So the biggest barrier is logistics. Getting my patients to pulmonary rehab. The closest pulmonary rehab facility that we have from our location it's about 25 minutes away, which with traffic can become 30 to 40 minutes. A lot of my patients are elderly. They obviously have bad COPD, so they can't really exert themselves a whole lot. So getting around to places is hard. And with in-person pulmonary rehab, obviously it's great. They have in-person pulmonologists, respiratory therapists, things like that. But logistically, sometimes it's really hard to get for the patients to get out there. And that's been a huge barrier for me and my population. With Kivo, what we have is the ability for patients to get rehab at home. And I mean, that has been a very big, kind of game-changing experience so far. Most impressive one actually is a patient who initially established with me for severe COPD, came in, was unable to walk from like the garage to the office, and then from the office to like the exam rooms. After undergoing his therapy at home with Kivo, he's doing like 6,000 steps a day minimum. I recently followed up with him, and he almost gave me a hug. He almost broke down in tears, saying like, this is the best I have ever felt. And to me, that's like all the validation I would ever need. So I'm gonna really the most important thing that I can share is pulmonary rehab is the most beneficial thing that we can do for our patients with lung disease, COPD, severe interstitial lung disease, IPF, things like that. For the first time, at least in my practice, I'm seeing a home option for these patients where, if it's hard for them to get to a pulmonary rehab center or something like that, consider a home evaluation with Kivo, because, so far my experience has been excellent. And I think all patients should be able to undergo pulmonary rehab to kind of improve that quality of life component.